1/3 of all U.S. women will have a hysterectomy by age 60. The old-fashioned way of doing the surgery meant considerable time off work and a long recovery. The Da Vinci robot is now making grueling gynecological surgeries a thing of the past. And here to explain from St. Joseph Medical Center, please welcome Dr. Olga Swanson along with patient Amy McKinney. Good morning. This is that time of year where a lot of people will schedule surgeries because they have some time off with the Christmas break. But who wants to spend that whole time off recuperating?
Exactly.
We'll talk more about this particular method in a minute. But when it comes to hysterectomies in general, two things that need to be figured out. Oftentimes the question really needs to be asked, is it really a hysterectomy that you need?
Absolutely. And a lot of women come in nowadays and they say, well, I'm bleeding real heavy or I've got severe pain. I just want a hysterectomy. And oftentimes that's absolutely the wrong way to go.
Yeah, you don't want to yank out body parts unless you have to.
Absolutely. And it's a hard recovery regardless, and it's a big surgery regardless of how you look at it. So a lot of times now we're able to offer women things like endometrial ablations, where we just go ahead and take care of the inside lining of the uterus.
Yeah.
At our office,
take care of the direct problem.
Exactly. And at our office, we're able to do this in the office, which for most women just means an in-office copay for just a doctor's visit, as opposed to the huge deductible that a lot of women have to pay when they do go.
Right. And of course, with those less invasive things, the downtime, risk of infection, all that type of stuff.
Of course, the bleeding, the complication rate is almost zero.
Yeah. All right. Amy, you were dealing with some issues there and struggled to the point where you had to finally make a decision. So what were you going through, and what was the point where you said enough?
Well, I had had a C-section in '98. I had complications with my uterus. I had severe pelvic pain in 2002. I was diagnosed with endometriosis. I had a history of it. I had multiple surgeries, bigger surgeries, smaller surgeries. And then I had a hysterectomy in the summer, this past summer. So I just had a history, pretty much a history of scar tissue problems, uterus problems, endometriosis.
Yeah, she'd be a perfect example of somebody who now you're saying, okay, this is where we might need to go.
Right. So she had multiple issues. It wasn't just heavy bleeding. It wasn't just pain. It was kind of the whole package.
Yeah.
And after a very extensive workup, we decided that really the hysterectomy was the correct thing to do.
A lot of women will put it off because they remember their mothers getting one or grandmothers or whatever.
And their foot-long scars.
Yeah, the long scars and then the long downtime. So explain how we're doing it today and what this Da Vinci robot really is.
Well, the Da Vinci system is fantastic because for women that really do need to have a hysterectomy, it offers them the option to have a recovery time, and oftentimes they go home in as little as the same day.
That's amazing, because that's not the way it used to be.
We do the surgery in the morning. It takes 2 to 3 hours a lot of times, and then they're able to just be home with their families by dinner time.
Yeah, well, we're looking at that machine right there. So basically, you're sitting at that machine.
You're sitting at that machine. These instruments that we have here, and we can show you, are hooked up to the little arms that you see in that video there. And the incisions that we make on the abdomen to allow these instruments into the abdomen are about 1/4 of an inch in size.
Wow.
And generally speaking, there's 3 to 4 incisions. And these instruments that we control sitting at the console, and you can see the arms and the instruments working right there.
So these become your hands.
These become your hands, exactly, and which is fantastic because you've got 360-degree motion. The visualization that you see is 3D. And there you can see the surgeon that's operating. Yeah,
you're working internally as opposed to before, again, like you're saying, cutting everything open and pulling everything out. This is just the way that you can do that there. It's amazing. I just happen to think that, this just might be my opinion, that if men had problems with their uteruses, that this Da Vinci thing, in fact, Da Vinci himself would have probably come up with this machine before thinking about flying. He would have, talk about a Da Vinci code, he would have broken that code a long time ago.
That's right.
But this can also be used for other types of surgeries.
Yes. And we're doing myomectomies, which is removal of the fibroids. A lot of times we see women that are having heavy bleeding. They may or may not be done with having babies yet. And a hysterectomy, again, may just not be the right approach. So then we can take out fibroids using these. Again, 3 to 4 little tiny incisions on your abdomen. Recovery time very, very short.
Yeah.
We're able to take out an ovary or a mass on the ovary. A lot of times with these as well, help with prolapse. If someone's bladder is falling or the rectum's falling, we're able to do that as
This is just like one of the areas that you cover at St. Joseph Medical Center when it comes to women's health. Some of the other things that you do when you address women's health there.
We talk about birth control, of course. We do routine well women exams, which is kind of where everything begins. We do adolescent health as well. A lot of the minimally invasive procedures in the office, such as ablations that we talked about, leaps for abnormal pap smears, biopsies, D&Zs, things like that.
All right. And so how are you feeling today, Amy?
I'm fabulous. It was a very easy recovery compared to the past surgeries I had, and I found that I wasn't reaching for those pain pills as frequently as I did in the past. I mean,
so now you're done. That kind of pain is over for you.
Oh, yes.
All right.
Yes,
Amen,
I'm
sister.
great.
Merry Christmas.
Thank you so much. Thank you.
Thank you. For more information on the Da Vinci robot, you can contact St. Joseph Medical Center at 713-757-7575, 713-757-7575, or log on to sjmctx.com.